Good afternoon. We continue with our VTE awareness series, and on today's post we discuss, can clots come back? What are the VTE recurrence risk factors that you must know? 1 in 3 people who survive a blood clot experience a recurrent clot in 10 years. So what makes the clots come back? There are many factors that make clots come back, and one of them are genetic clotting disorders. Some people have problems or genetic deficiencies with clotting factors like antiphospholipid syndrome. You lack some of those factors that make your blood more predisposed to clotting disorders. Another reason for recurrence is inadequate treatment of a clot. If you have DVT and you stop your treatment too early, or you don't take your medication as prescribed, inadequate treatment, stopping prematurely, this allows the clots to reform. So you need to ensure that once you get a clot, the clot is treated and treated adequately, and you comply on the doctor's advice. That is very key to preventing recurrence. The other reason why clots come back is if you have an ongoing medical condition, things like cancer. If the cancer was what made your clot come back and the cancer is not treated, the clot can still recur. You may have ongoing medical conditions like heart failure. This can still ensure that your risk is still there for the clot formation. The other reason is ongoing risk factors. Ongoing risk factors mean you may have a stroke and you are completely paralyzed, meaning you have prolonged immobility. Even if you treat the DVT, you can still have another clot if the risk factor is not addressed. Other things, dehydration, obesity, smoking, hormone replacement therapy. So all these risk factors make or increase the chance of a clot recurring. And who is at highest risk of clot recurrence? If you have had a history of multiple blood clots, you are at increased risk. If you have a clot with no risk factor, what we call unprovoked DVT, if you have unprovoked clots, you have a higher chance of recurrence. If you have an ongoing chronic condition like heart failure, cancer, this can make, and very, very key, if you have improper treatment of the first episode, stopping your anticoagulation too soon, not complying to medical therapy, that is a major, major risk factor to recurrence. So how do you prevent your clots from coming back? Number 1, once you get a clot, follow your treatment plan strictly. Do not skip doses. Do not stop treatment until your doctor advises you. If you're on drugs like warfarin that require monitoring, ensure we are monitoring them regularly. If you're also on drugs like warfarin that interact with very many drugs and also medication, follow your doctor's instruction. So very key to preventing recurrence is complying with treatment of the initial clot correctly and for the right time. Number 2 important thing to do to prevent another clot, have the discussion with your doctor. On completion of treatment, please discuss with your doctor, am I at risk of getting another blood clot? Do I need to be on continued blood thinners? For example, if you have had multiple DVTs, second or third episode, after treatment, you are meant to be on prophylactic blood thinners to prevent another clot. We talked about pregnancy. Once you get a first episode of clot in pregnancy, the subsequent pregnancies, you should be on prophylactic blood thinners. So have that discussion with your doctor. Are you at risk? And you need to be on prophylactic blood thinners. For some people, we also prescribe compression stockings. An also important thing to prevent recurrence is stay aware of your personal risk factors. We have discussed the risk factors for clot formation, so you need to be aware so that you can protect yourself. Stay active, hydrate well. If you travel for long distances, take breaks, walk and stretch, maintain a healthy weight, quit smoking. All those are things you can do to prevent a clot from coming back. Attend regular follow-ups. Be aware of your risk. Stick to the treatment plan. Through all these measures, you can prevent a clot from coming back. And if the clot comes back, you are already aware of the symptoms. See your doctor urgently. We want to hear from you. How long were you on blood thinners? What challenges did you face for sticking to plan? Share your story. You may encourage others. Don't miss tomorrow's post where we will discuss on VTE prevention in surgical patients. We see very many patients who develop clots after surgery. So who needs blood thinners? So stay tuned for that post. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.